But I think it's really important for us, people with asthma out there, not to worry too much. Many of the studies that have been published right now, the science is telling us that individuals with asthma may not be at a higher risk of severe disease than other people, especially if their asthma is well controlled. This is key. If their asthma is not well controlled, when they get COVID, they could struggle. But otherwise, if they have well controlled asthma, they are on treatment and their asthma is well controlled, the risk of severe disease may be minimal. However, asthmatics should be vaccinated like other people, and because they are living with a chronic illness, they should be prioritized to receive the vaccine. And the vaccine is safe and effective in literally all patient populations, including those with asthma. When you're vaccinated, it's basically your body is challenged by components from this virus to induce an immunological response, a defense response. And that defense response is meant to last a certain period of time. Ideally, it should be lifelong, where you now know you have a strong defense system against that particular thing that you've been vaccinated against. So in essence, when you're vaccinated, your body is being given something that should imitate the natural infection. And so that's why a lot of people feel sick, because the natural infection makes you feel sick. So you get your headaches, you get your fevers, and you can't stimulate an asthma attack, because a lot of people with asthma, when they get a viral infection, when they get a cold, for example, their asthma can flare up. Now, if your asthma is well controlled, getting a cold does not increase the risk of we call them asthma exacerbation, because your asthma at the background was good, it was well controlled. The inflammation inside the air pipes has been nicely put down, it's been controlled. So you get a cold and you don't flare up very badly. You might get a small bump, but you don't get a big bump. If on the other hand, your asthma was poorly controlled, that fact that you've been given something that mimics a natural infection can give you an asthma attack. A lot of the vaccine trials that have been done have included all manner of individuals, including those with chronic diseases and asthma, COPD, the other common chronic lung disease were included in those. It wouldn't have made any sense to exclude people who have pre-existing disease, and those are the ones that tend to have severe problems when infected with the virus. There are individuals who, for some reason, despite being provided with the best possible treatment by the best possible clinicians, still end up struggling with their asthma. Those are called people with difficult to control asthma. And then you have people who have such mild disease. It comes once in a while. They might go for several months, sometimes without feeling anything. When they feel something, it's very mild. And by and large, it's like they don't even need regular treatment. So you have those people on those boxes. And you can, every individual who arrives at a doctor's office and a doctor makes a diagnosis of asthma, they should be able to place that individual in some box. That usually means that the doctor must follow you up for a period of time to be able to fully characterize or get a long-term story of how you behaved in the past, to be able to say this individual belongs to this box. Yeah. So there are individuals that are very, very difficult to control asthma. If you take about, say, 100 people with asthma, those will be about 1 or 2 who have really difficulties in achieving control. The majority of people with asthma in the world can be controlled with the existing therapies, and usually not even high doses of medicines or multiple medicines, just one, maybe two medicines or so are enough to control these individuals. So these kind of things are happening all over the world. I get phone calls every day from people who have chronic disease who ask me, should I take this vaccine because I am at risk of side effects? And I say, fine. I just want you to get this scenario. Out of the 1 million people, there may be one death. You can't compare 200,000 people dying from the virus from one person dying from the vaccine. These are called risk-benefit analysis. That's why public health people look at all this data and say, overall, we know that as we vaccinate people, there'll be 1 or 2 people who might have problems, and they may have even severe problems, but the bulk of the population will be saved. Yes, it's hard luck if you're that 1 in a million who gets a big problem, but the majority of people tend to benefit from the vaccine. That's really what the essence of vaccination is about. But we know that some people can get serious problems, but there are very few who get serious problems. The majority of people get things that are transient. Most people get nothing. Some people get minor side effects, and those who really have very bad side effects, and especially that big side effects that is called death from vaccination, very small. When a diagnosis of asthma is made, one should not expect that there will be a medical treatment that is going to cure them. There is no cure for asthma. Just like there is at this moment in time, there is no cure for hypertension and diabetes and many other chronic diseases. However, asthma for the majority of people is very easy to control. Now, we define control by the presence of certain things. When asthma is controlled, the individual is free of symptoms. They don't cough, they don't wheeze, they don't have tightness in the chest, and they have no difficulties in breathing. They have a normal exercise capacity. They can do anything they want to do, including engaging in competitive sports if they want to do that. They have lungs that are functioning normally. They are using medicines that are not giving them side effects, and they have no attacks.